Good afternoon, everyone. Wynn Brown here with Heywood Healthcare's weekly update for the week ending September 10. Kids are back in school and COVID is in our midst and surging. You'll see in the midst of this email a chart for all the towns in our region, and you can see how high we are trending. I actually don't have our testing results for the day today, but I can tell you that we've had over 100 positive findings in our COVID testing in the past 2.5 days, and it's still climbing. Incredible number for us, and it really is stressing our resources. At Heywood, we have 14 COVID positive inpatients, 3 on ICU, 3 in our walk-ins unit, and 1 rule out as well. We also had 3 patients pass away this week from COVID-19 that we were diligently caring for, but were unable to get them through. So it is real, it is here, and our hearts go out to those families whose loved ones passed away, but it also is a reminder to all of us how deadly this virus is. And I know that different parts of social media like to play it down and say it isn't anything. It is something unbelievable. Our staff is right now at about 95% vaccinated as we head toward our October 1 requirement that you be fully vaccinated. And yesterday, the president announced that all healthcare workers in the country need to be vaccinated. And I personally appreciate that vote of support for the work that we were already doing, but also puts everybody on a level playing field and making sure that our healthcare providers are safe and understand how important it is. So take a look at the graphs here and you will see how we are doing as a region, and we are an outlier region in the state. We are incredibly high, and just make sure that you do everything you can to stay safe. As you know, hand hygiene, wearing your mask, social distancing, and talking to your loved ones and friends who are not yet vaccinated and convince them to get vaccinated. That's your job this week, is to get that done. Because if you remember my video from last week, and I walked you through the stages of the COVID disease, if that didn't stir you to action, maybe our numbers this week will do that as well. So please make sure that you get that done. Just a reminder, we've had a number of inquiries that people have lost their vaccination cards. So you can get a new one done by filling out a form and emailing it to vaccinate@heywood.org in that form, and we will work to get you a new replacement card. Also know that we expect that booster shots will probably be authorized at the end of this month. And so those are available at our local pharmacies, and we expect that we'll probably at least stand up a few clinics in the region to help people get that done. For those who are coming to Heywood Hospital, please know that the south entrance is closed due to our restricting the entrances and making sure that everybody gets screened. And those who get screened, please be patient and pleasant and helpful to our staff and volunteers who are screening you, taking your temperatures, giving you a fresh mask. Remember, no cloth masks in the hospital as well. And just pause and make sure that you take care of business as you enter both of our hospitals. A shout out today to the Athol Hospital, which finished its triennial unannounced Joint Commission survey and killed it, rocked it, did an amazing job, and I'm incredibly proud of the staff at Athol in the midst of everything that's going on, including some movie filming that was happening up on the vacant third floor. We got a lot done this week, and I know it was a heavy lift for everybody, and I'm just so proud of the team at Athol, and I'm also proud of the team in our Heywood lab, because Joint Commission arrived there as well. When it rains, it pours, people, and our lab stood up and did incredibly well. And so a shout out to Dan French and his team for the great lab work that they are doing, supporting the whole entire health system in the whole entire region. We've had some people note that at the main entrance at Heywood Hospital that there seems to be a shortage of accessible parking spots. And so we are actually working to make sure that our valet parking is no longer considered valet parking, so that you know that those are available, and making sure that staff are parking in the employee spot and not taking up any spaces there as well. If for some reason you can't find a spot, please just pull up to the main entrance and security will take care of your car for you and get that valet parked. Also, just like every other business in the country, and in the Commonwealth, we have ample job openings across Heywood Healthcare. Our minimum wage starts at $15 an hour with great benefits. So I encourage you to hop on our website and take a look at what's available there for you or friends that might be interested in joining our family. And just then, finally, some important save the dates. Our Watkins Faust Open Heywood Hospital Golf Classic is September 27th. It's full, but I do believe we probably have some spaces for dinner if you want to come to dinner. Athol Hospital Annual Golf Class is October 4th, and we still have a few spots remaining there. So if you want to do that, it's a fabulous event as well. And our Healthy Harvest 5K and our rescheduled Ride for Your Life motorcycle ride has been joined together on October 23rd. And you can share this event widely, please, and visit heywood.org for more information. And in preparation for the Healthy Harvest 5K, thanks to Jillian Hillman, a beginner, intermediate, and walking training program can be found here in a link. So again, amazing work done across North Central Massachusetts by our amazing Heywood Healthcare family. We are Heywood strong as we continue our journey to be one of the best community-owned health systems in America. Have a great weekend. Be safe. Get vaccinated.